Hello and welcome to another edition of Nurse Amy TV channel. Thank you so much for coming. For return subscribers, I'm eternally grateful because, I couldn't do this without you. And for new subscribers, my name is Nurse Amy and I'm a CNA instructor. And this is the channel for everything LPN, CNA, LVN, RNs, things that we go through at work, things that we go through even at home. And also I give topics on things that happen in CNA school and nursing school. So I am that one-stop place that you can come to. Feel free to ask me any questions. And please, if you're getting value on any of my topics and even videos that I share on skills, please be sure to subscribe and hit the notification bell so that every time that I upload a video, you will be notified. So having said that, I quickly want to touch on a topic I had, I think it was uploaded last week, and it had to do with, I'll put it up here somewhere, and it has to do with, I think the title was, I Am Not Your Honey. And I did get a lot of reactions from that video. And, well, the reactions were kind of mixed. I would say mixed in that a lot of people were really glad that I talked about it. And then there were others, that DM'd me. One person in particular DM'd me in my Instagram and said, well, I was raised to believe that calling someone honey and calling someone darling or dearie are terms of endearment, which I already established, and that she didn't see it as a bad thing. And I just want to quickly touch on that. Okay, you might not see it as a bad thing, but you need to understand it's not about you. It's about how you make your patient feel. Your patient probably doesn't care to be called anything other than the given names, right? So if there is a Mary, she should be Miss Mary or Mrs. Mary or Mrs. whatever her last name is. Okay, please understand me here. Whatever you have been given permission to call that patient is okay. You don't take it upon yourself to determine what you want to call them. It's not about you. It's not about your opinions. It's not about how you feel. It's not about how comfortable you are. And I'm hoping that you're understanding and taking this in the way that I meant for you to take it. So for that person who DM'd me and said, well, she doesn't see anything wrong in it, it is wrong. I'm telling you right now. My name is Amy. I like to be referred to as Miss Amy or Nurse Amy, and that is what I want to be addressed as or called. So if you call me honey, you're disrespecting me. You're disrespecting my choice. You are undermining me, my dignity and my respect and my autonomy. Do you understand that? Now, the person who DM'd me, you have a name and maybe you have a nickname that you want to go by. Say, for instance, at work, we all have our names, okay, our legal names. And then they also go farther in some of these places where you work. And they ask you, do you have a nickname you want to be called by? That is all affording you a chance to express yourself. So it's possible that I'm Amy, but my nickname that I want to be called is, say, for instance, Mimi. That's what I'm giving people permission to call me. So it would be out of place, rude, disrespectful, and totally lack of everything decent to now decide to call me, I don't know, Jane. Well, I'm not Jane. And you don't have the right to change my name or change or address me in a way that makes me uncomfortable. You need to understand this. When you are dealing with patients, when you're taking care of your patients, you have permission to be around them. It's implied expressly, and sometimes it's just because you work there. Okay, they have a right to refuse to accept care from you. They have a right to refuse you being in their space. So if Miss Mary wants to be called Jane, Baby Jane, well, she's giving you permission to do so. You've got to respect that as much as you want people to call you the way you want to be called. And I'm hoping that you totally understand where I'm going with this, and it makes sense to you. It's not about you. You need to understand that going in, you have permission to work with them, by them. Okay, it's a place of work. You have to be professional at all times. So again, I am not your honey. I have my own honey. My husband calls me honey, and that's fine. I call him baby and I call him honey. That's our thing. So it's not okay for me to go to work and call somebody else honey. It will not be a term of endearment to that person. They don't know you like that, okay? So let's just get that out of the way, and I thought I should go ahead and address it. And if you have comments and you have questions, feel free to DM me. My Instagram page is Nurse Amy Academy. Also, you follow me on Facebook, is Nurse Amy Academy, or Nurse Amy. And of course, as usual, please come back here and let me know what topics you want me to treat or address, and I will do so gladly. Again, if you've received value, please go ahead, hit the notification bell, remember to subscribe, and I'll see you in the next video.